Roligt att så många ville komma. My name is Josefsson and I'm a journalist. I wrote this book that was published in October. Mannen som slutade ljuga. The English title would be The Man Who Stopped Lying, the story about Sture Bergwall and the woman who created Thomas Quick. It will be published in English next spring, possibly under a different name because no one knows who Sture Bergwall is or Thomas Quick in England. I also produced a documentary about the Thomas Quick psychotherapy together with Jenny Kyttim, who is a researcher and television producer, that was shown this fall. I will give you to explain the Thomas Quick psychotherapy or the Thomas Quick case in 20 minutes. It's a very special task. The book is 500 pages, so I'm going to get right down to it. In 1990, Sture Bergwall robbed a bank. This guy was 40 years old. He had been a drug addict since his early teens, and he had a criminal record. When he was 19 years old, he sexually abused 4 boys, age 9 to 12. He was abusing at that time. He was drunk, and he was also high on sniffing hallucinogenic solvents and stuff like that. He was not kind to himself at all. And after that, he went in and out of psychiatric care for many years. He used lots of drugs, preferably amphetamine, but also alcohol and different kind of medication. He was mixing more or less everything he could get his hands on, except heroin. And when he was 23 and he was high on this mixture of drugs, he stabbed a man almost to his death. But that didn't send him to jail either, because he just got back to psychiatry. But he managed actually to get a hold of himself. So in the end of the 70s, he kicked his habit, and he was actually drug-free for over 10 years. At that time, he only took a small dose of Sobril, that's oxazepam, that he actually managed to control. But in the end of the 80s, he relapsed into substance abuse, and he committed this robbery that was really crazy. They got him the same day. And since he had this record of psychiatric problems, he was committed to the hospital for the criminally insane at Säter, that is 2.5 hours from Stockholm. Now, Säter was a pretty special place. It had been around since 1912, treating criminally insane people, but they had just 2 years before Sture Bergwall got there, they had just built an entirely new clinic. And the goal of that was to really to modernize the care of these criminals. And the core of the idea was that they were going to give the criminals psychotherapy. That was the idea. And the clinical ideas came from this woman. Her name was Margit Norell. She was a psychoanalyst, and she was not employed by Säter, but she was giving supervision and also psychotherapy to the head doctor at Säter. And he was the man who actually started this new clinic in 1989, and he was very influenced by Margit Norell's ideas. Now, Margit Norell, she had a very, very strong conviction that repressed memories of sexual abuse in childhood is the solution, or really the answer to almost all psychiatric problems. Her background is really fascinating, and I spend a lot of time in my book telling about her background. It's like looking into the history of the psychoanalytic movement, but we won't have time for that here. But I'll just give you something like a brief look in the 1950s, she was trained as an orthodox psychoanalyst, the orthodox Freudian psychoanalyst, but she turned away from Freud partially and became a neo-Freudian, and that means that she was, among other things, she was very critical of Freud's drive theory. It's all in the book if you're interested in it, and but what's important for the Thomas Quick case is that Margit Norell was, as early as 1976, I found evidence that she was experimenting with the regression therapy. That is a therapy type where you try to make the patient regress to an earlier age to remember repressed trauma or to recover repressed memories of sexual abuse. She was doing that in 1976, and that's pretty early, I think, because this kind of therapy really exploded in the world in the 1980s. I mean, this kind of therapy was, at its core, it was the therapy that Sigmund Freud was giving or experimenting with before 1897, before he actually constructed the drive theory. Margit Norell was she read a lot, she knew a lot, she was very well studied, and she knew about Freud, she knew about the history of the psychoanalytic movement very, very well. So she was very fascinated by the early Freud. And this was something that spread over the world, that kind of interest in the 80s. These are some of the books that were published by then. So of course, Margit Norell was really intrigued by the psychotherapists all over the world who tried to recover these supposedly repressed memories of sexual abuse, when she had actually been doing this in the 70s, very early. So she felt that now the world is sort of understanding what she had already understood. So what happened was that since she started to work with this doctor at Säter, when he started the new clinic that was supposed to be a modern clinic, he was very influenced by Margit Norell. So the idea of trying to recover repressed memories of sexual abuse became the core of the clinic, of the clinical thinking, the psychotherapeutic thinking at Säter. In my book, I quote a text. It was a little secret, a little bit. The stuff that they did at Säter, they weren't open about it because it was controversial even at that time. But I found a text about that actually states what it was all about. In the therapies at Säter, there is an ambition to help the patients to get in contact with early trauma. Fragments of repressed memories become visible, and the pieces form a pattern that eventually becomes a comprehensible whole where the different fragments hang together. This was written by a person who very shortly after was employed as a psychologist at Säter. So this was a treatment they gave the criminals. Sture Bergvall got therapy from a guy, a doctor, this one, Kjell Långbergs, who did not have any training in psychotherapy at all. He was a doctor, but he got supervision from Margit Norell, so that didn't matter. So and the techniques used were very much the same techniques that Sigmund Freud used in the 1890s. It was free association, guided imagination, and dream interpretation. That was the way they tried to get hold of the repressed memories of this criminal. You could see the consequence of that in the medical journal. There's an entry in the medical records from April 1992. It's one of the first about the therapy, where the doctor writes, "The patient has examined his childhood experience, which previously seems to have been fairly well hidden, but this has brought up more and more memories. He has also examined dreams." Now, this is not a therapy that this doctor learned at medical school. It was all Margit Norell, of course. So today, when you ask Sture Bergvall, he says that he was never honest in this therapy, his goal was really to feel less alone. He was a very lonely person sitting at this hospital surrounded by rapists and murderers. He wanted someone to talk to. He looked upon himself as an intellectual, and he needed that kind of stimulation. So he wanted the therapy as a sort of, not to feel lonely, but he also wanted drugs. He wanted to have lots of benzodiazepine drugs, and that was easier to get if he was in therapy. And also, um, he had this idea that he actually wanted to get cured from his homosexuality because he felt that that was some kind of psychiatric problem that he had that he could be cured from. So those were the reasons why he was in psychotherapy. But what he did in psychotherapy was really telling the doctor what he thought that the doctor wanted to hear, and so he talked about his childhood. Uh, but in the fall of 1992, they wanted to release him from Säter. They had just wanted to have him here there for 1 year. They thought the bank robbery wasn't that serious. They wanted him to leave, but he was afraid of leaving. He was afraid of killing himself with drug abuse. So he wanted to stay at Säter. And the only way to do that was, he thought, to become an even more interesting patient. So he started to tell a story that he had killed Johan Asplund, an 11-year-old boy who had disappeared 1980. It was a very well-known story that he had read about in the papers. So it said that he had gone to the place where Sundsvall, where Johan Asplund lived. He had abducted him and abused him and killed him and hidden the body. But after that, he had completely repressed all memories of this incident. So he had had no idea during all these years that he was actually the murderer. And Säter believed this story. Not only did they believe it, they thought that Säter was now doing some revolutionary breakthroughs in psychotherapy, that they were in the forefront of something very, very big. They were actually recovering repressed memories of severe crimes from a patient. So he became the favorite patient of all Säter, Sture Bergwall. But the murder story that he told in therapy was not believable at all by conventional standards. He constantly changed his story. In one session, he said that he had killed the boy with a knife at the same time as he had sex with him. In the next session, he said that he had strangled him. It was very completely new stories, and that's very obvious why. It was the product of free association. He was lying there on a bed and associating. So anything that came up, he just told. And that was okay with the doctors because they really thought that this is sort of repressed memories coming back. And of course, it's hard to get it exactly right at first try. So he could just keep on going. But after a few months, they wanted to call the police. Säter told Sture Bergwall that we are going to call the police is coming. And Sture Bergwall got a shock because he didn't expect this to become a police matter. He thought that this was something that he was doing in therapy, and only in therapy. So he tried to get out of this mess that he had started to create for himself. And what happened was that, let's see here. One of the doctors at the hospital wrote an entry in the medical record about how Sture actually tries to get out of it all. He says that today I'm talking to the patient again, and it seems like the emotions that the crimes raises are more distant. He is already significantly more doubtful. He describes it almost like fantasies, where it has been unclear whether this has indeed happened. But he now have these fantasies confirmed as a result of the ongoing psychotherapy. So the message was that he didn't really believe in it himself. It was just confirmed through psychotherapy, and it was more fantasies. But the interesting thing is that what happened now was that the belief in repressed memories sort of trapped Sture Bergwall. Because if you know your Sigmund Freud, if you've read Sigmund Freud, what he's writing about his therapies in the 1890s, you know that he believed that when a patient protested against the notion that she had been the victim of sexual abuse as a child, Freud interpreted that protest as a proof in itself that the abuse had actually happened. And Margit Norell had exactly the same notion. In a paper she wrote about recovered memory therapy in 1989, and that was, of course, had to do with incest, not murders. She wrote, came with this rhetorical question: how can you know that these incest experiences are true? Because all the patients she writes about in the paper, of all the patients, none of them had had any idea about any sexual abuse before they came to Margit Norell. It was all something that came up during regression therapy. So how can you know that these incest experiences are true? And she gave the answer. First and foremost, of course, by what happens in the therapy room with strong resistance from the patient. So the strong resistance was, agreed with Freud, the strong resistance was in itself proof that this was true. So when Sture Bergwall suddenly started to get out of it, tried to get out of it, he just confirmed that this was really repressed memories. And he was a murderer. So the police came, the prosecutor, Christoph van der Kwast, and the interrogator, Seppo Penttinen, came to Säter. And when they got there, the doctors told them that you be aware now, because this is not your regular suspect. This is a guy who suffers from suppressed memories, and that could make his stories less believable, because should appear less believable. So, but you should keep at it. So they started to interrogate Sture Bergwall. Now, he didn't want to admit to anyone that he had lied in therapy, so he played along. But he did exactly as in therapy. His stories changed constantly. It was completely unbelievable. He couldn't describe his victim. He couldn't tell what clothes Johan Asplund had worn. He couldn't say where the body were. He couldn't. He still couldn't make up his mind of how he had killed the boy. There was nothing that actually worked in the story. But so in hindsight, it's very obvious that he is lying. It's obviously a person saying that he has killed someone, but he doesn't know anything about this murder except for the small information he had read in a newspaper. But the problem was that Säter, they were so convinced that he was a murderer, so they managed to actually talk the police into believing in this. And I have talked to one of the doctors, and he admits to this, and he feels very guilty about it. And he thinks that what he believed in was crazy back then. So it just went on. Let's see here. Yeah, so what happened? Why didn't Sture just refuse to be interrogated? I mean, why didn't he just say, I'm not going to talk to the police, and nothing would have happened? The reasons were that he really wanted to stay at Säter, was very afraid of being kicked out. He did want the drugs. He really needed the drugs. He was treated like a hero. When the police came, he really became a hero at Säter. He was very brave, they told him. He was almost like a saint doing this struggle to get back to his memories. And the psychotherapy was extremely suggestive, and it made him very confused in combination with the drugs. In 1994, the psychologist Birgitta Ståhle became Sture's therapist. Here is a picture of the two of them. They are in session, in regression session, remembering murders and sexual abuse. The stories that he told in psychotherapy was extremely grotesque. It was he dismembered the bodies. It was cannibalism. He was eating his victims. He created secret places all over the woods in Norway and Sweden, where he hid parts of the bodies, and he returned to the places, and it was really grotesque. He took a lot of the stuff directly from American Psycho. The book American Psycho by Bret Easton Ellis, and I checked that. It's very obvious that he did that, because he had read that in 1991, so he had that as an influence. So that was what he was going on about, and also in the police hearings, sort of like the interrogation, the police interrogation and the psychotherapy became one thing. It was just two sides of the same coin. Police and psychologists were working in order to get this guy to remember all his murders and confess to as many murders as possible. So, and then in an interview, the prosecutor said to a journalist, "No real hearings are held with the patient. Hearings take place in the form of therapy with medical expertise and interrogation personnel present." So it was a very, so also the police also felt that they were doing something revolutionary and very new. In the interrogations, the police thought that they really ought to help Sture Bergvall to get back his memories. He was fighting so hard to get back these elusive memories. So they asked him a lot of leading questions. They were repeating questions over and over when getting incorrect answers. And they were constantly interpreting Sture Bergvall's body language and anxiety symptoms. He had lots of anxiety when he was telling his crazy stories. They interpreted this as sure signs that he really knew the right answers, even though he couldn't really say them. Somewhere in him he knew. So they thought that you can't have that kind of anxiety unless the stories you are trying to tell are true in some sense. And they also took him to reconstructions, lots of reconstructions. They did trips all over Sweden and also Norway. There were some Norwegian murders where they sort of, and the entire goal of this was to make Sture Bergvall remember what he had done. And so those were also repressed memory sessions, really. And sometimes he regressed during these trips in the woods or sort of returned to the murder date, year and date, and relived and said that he relived things that happened back then. He was screaming and shouting, and it was very, very dramatic. One thing that also helped the police was that they enrolled a memory expert named Sven A Christianson from the Stockholm University. He became an expert helping the police dealing with Sture Bergvall and explaining the memory problems that Sture had to the police and confirming very much what Säter had said. And this Christianson, he also put forth these ideas in his academic writing at the time. In 1997, there was a book published called Recovered Memories and False Memories by Oxford University Press. And Christianson wrote a chapter in that book, writing about Sture Bergvall. He said, "A man is receiving therapeutic treatment at a psychiatric ward. After some time, he begins to tell about one murder after the other that he has committed. Murders committed during a time span of 25 years in which he had been very reluctant to consciously access before going into therapy. Not until the serial killer was sentenced to psychiatric treatment for a series of minor crimes and found himself in the relatively safe environment surrounding therapeutic treatment did he begin to slowly recover memories for the sexual sadistic murders that he had committed on young boys. Memories of the killings caused overwhelming anxiety due to the fact that they were in part a reenactment of the sexual sadistic abuse that the serial killer himself had been subjected to as a child." This reenactment idea was something that Margit Norell was really into, that you were symbolically, the criminals were reenacting symbolically what they had gone through as children. So this was something that Christianson also stated as an expert witness in the trials. So Sture Bergvall was believed, and Sven A Christianson worked intimately with the murder investigations from 1994 and all the way until 2001, when Sture Bergvall was convicted for his 8th murder and quit therapy. He was in the picture all the time. He was convicted of 8 murders in 6 trials from November 1994 to May 2001, and these are the victims that he supposedly killed. Christianson witnessed in 5 out of 6 trials as an expert, and the prosecutor also helped, of course, by withholding a lot of information about how Sture Bergvall's stories actually had been created, because he had said so many wrong things about all these murders, and the courts never was informed about the all that. So that's also a reason why he actually was convicted. It was foul play from from the prosecutor's side. Um, in my book, and in mine and Jenny's program, we show that Sven A Christianson was in fact Margit Norell's patient for 10 years during this entire period. Once a week he was sitting in that chair, and she was the most important grown person in his life, he stated in an interview. So that might have had something to do with it. Margit Norell was fascinated by Sture Bergvall or Thomas Quick. She was writing a book about him. It was supposed to become a case study that would be, she was convinced that it would be more interesting and more influential than the Wolfman, Freud's most, the case study that Freud valued most. So they were really into it, this Thomas Quick thing for 10 years almost, or 7 years at least. All in all, Sture Bergvall confessed 39 murders. This list is from my book. So he was actually just convicted for a fraction of them. He was, during the later part of the 90s, he became more and more confused by this suggestive therapy that was going on more or less around the clock, combined with the heavy medication. He got lots of medication. So he started actually to believe that he was a serial killer. And that was in the end of the 90s. I will soon wrap it up. To conclude, there was a group that created Thomas Quick. It was a group of people. It was a group effort. Sture Bergvall was one of them, but he couldn't have done it alone. The belief of repressed memories was very important for this to happen. Couldn't have happened without that belief, really. But in 2001, a doctor took away all medication. He realized that something was very wrong. He took away all the medication from Sture Bergvall. In 6 months, he quit therapy. He stopped talking to the police. He became a new person without any psychiatric symptoms at all. And 6 years later, he talked to a journalist named Hannes Rostam and admitted that he was not a serial killer. That started an appeal process that took 5 years, and today he is actually all the convictions are overturned. So he's not a murderer anymore. Last page. My conclusion in the book, one of my conclusions, is that Säter was very inspired by Sigmund Freud's early work. The therapy that Sture Bergvall got was more or less a blueprint of that kind of therapy that Freud left behind so early. And that this therapy was, of course, introduced by Margit Norell. If you want the full story, read the book. Thank you very much.